The massive vaccination drive begins across the country, and here in Karnataka as well, 243 centers, around 8 of them in Bengaluru. We are currently at the Jainagar General Hospital. This is one of the crucial vaccination center, and we'll just explain how the whole vaccination drive will take place on a daily basis for the coming few months when the frontline health workers will be vaccinated. To begin with, they'll get a message on the date and time when their vaccination is slotted. They would have already registered on the COVID app, after which they will approach the registration desk here. This is where the list is kept ready, taken from the COVID app. The data will be verified, the list of people who will come in, the beneficiaries, and the other details that are given in the COVID app that will be cross-checked. They will have to wait for their turn, after which is when the vaccination starts. You can see here, there's already one beneficiary who's being vaccinated right now, even as we speak. Vaccine is given, and also in time that's noted, 12:50. She's given a time on when she was vaccinated, which is also crucial because she'll have to wait for a good half an hour. That's the observation time. When she can't consume anything, she'll have to wait. We'll show you the observation place as well. You can see the whole checklist that's ready. All of that being explained to the workers here, health workers here. There's another healthcare worker who will now be vaccinated. He comes in with a printout, and also the message that would have been delivered to him asking him to be here at a particular time for vaccination. The details are once again cross-verified here by the healthcare workers. The whole list of people who are likely to be vaccinated or slated to be vaccinated at this particular center is here, including date, time, various other data like the ID number, gender, date of birth, month of birth. So all that data is present here. The other aspect is the number of syringes that's used in this whole vaccination drive. So Covishield, this particular vial has multiple doses. 0.5 is the vaccination dose per person. Okay, there you go. Another frontline healthcare worker being vaccinated here in Karnataka. Okay, instructions given on when his next dose will be. Once again, he's given a time on the time of vaccination and the waiting period. So that hardly took 2 minutes once he entered the vaccination site. And after that is the waiting area here, where everyone who's been given a shot will have to wait for half an hour to ensure that they do not witness any sort of a side effect, any sort of an adverse event, in which case there's also a room that's kept ready. On the right hand side, you can see that's the place where they will be taken in case there are any adverse events or any reaction. The hospital, most hospitals in Bangalore and other places where the vaccination is happening have kept most of the basic things ready to ensure that any reaction can be treated immediately. You've just received a shot of COVID-19. What was going on in your mind? There's been so much talk about the vaccination drive, the vaccine and the efficacy of it and all that.
Yeah, I'm a doctor here, so I have mixed feeling.
Okay.
Because we are enthusiastic to take the vaccine because we were waiting all these days for the vaccination. But I think any vaccine, it needs to be trialed. So because this trial, we feel it's not complete. So we are scared, a little bit scared and a little bit enthusiastic, and we have mixed feeling.
Okay. You say mixed feelings. Is it a feeling that's there across the community, whether it's this hospital, other places as well?
Yeah, most of the healthcare workers, they have this feeling. Okay. We are not completely confident that it may give immunity to us. like that. We don't have full confidence in the vaccine, but still, because we are the first people who are frontline people, we are getting the vaccine. So we have to support the government. So we are taking it.
Okay.
So hope it will give immunity to us. Yeah.
So the other aspect is the kind of side effects. Has that been clearly, as a doctor, you would obviously know the kind of side effects, but this is something that will have to be explained to the larger public once they come in for vaccination.
Yeah, correct. Even the side effects, like even the company itself says like 1 in 10 will have minor side effects, 1 in 100 will have severe side effects and all those things. This is actually really little like a small number, like 1 in 1,000, 1 in million. If they are getting reaction, we can accept it. 1 in 100, 1 in 10, I think it is something which is to be significant. And we'll see. We have taken the vaccine. We'll be here. So we'll see what will happen. Right now we are happy. Like there is no symptoms, no immediate side effects. We don't have anything.
Okay.
So we have to wait and see.
The other aspect that has to be noted here is Karnataka has got 20,000 doses of Covaxin as well. That's a vaccine that has more concerns among the medical fraternity and others otherwise as well. Would people here, doctors here, be more worried if the vaccine being given was Covaxin? I mean, thankfully, at least in Bangalore, Covaxin is not being administered anywhere.
Yeah. Like in other parts of Karnataka, like they are telling they are administering Covaxin. We are luckily getting Covishield, which is we are more confident, like more confident than the Covaxin, because the Covaxin they are telling it's not trialed in the third phase. At least this is a little trialed vaccine, so we are a little more confident on this vaccine, even though it's this also new in India. Like we are more confident on this.
Okay, thanks a lot, doctor.
Thank you.
There you go. A three-page complete consent letter is something that doctors who are taking Covaxin have to sign, and they are also explained the kind of side effects that's there. But overall, the vaccination drive has started. There could be a lot of relief in some sections of health workers. There could also be a little bit of apprehension about the efficacy, the side effects and all that. But the government really hoping that many of them will be addressed in the coming weeks as more and more people will get vaccinated. The confidence will increase. At the same time, the regulatory body also says they will get to know more about the vaccine and any adverse reactions, side effects, the efficacy, all that in the coming few days, and a lot more things might be clear by the time the vaccine is rolled out for the larger public. In Bengaluru, Harish Upadhyaya for the Federal.